Hi, I'm Louise from Taube Pilates. Today we're talking about active aging and meniscus tears, a very common condition as people get older. We'll cover what causes a meniscus tear, what a meniscus is, the symptoms you might feel, and how Pilates can help to restore the function, mobility and strength of the knee joint, reducing pain. I'll also share my own experience of recovering from a meniscus tear as a dancer. Inside the knee are two small pieces of cartilage called the meniscus. They sit between the femur bone and the tibia bone, which is the shin bone, the thigh bone and the shin bone. The meniscus acts as a shock absorber. It helps to stabilize the knee joint. It works together with the cruciate ligaments, the anterior cruciate ligament, the ACL, and the posterior cruciate ligament, the PCL, to help stabilize the knee joint. The meniscus distributes load evenly across the knee joint. It helps cushion the knee joint. It assists with stability. It protects the cartilage surfaces. Without a healthy meniscus, the knee joint experiences greater stresses and strains. As we age, the meniscus can gradually lose hydration and resilience. This means the meniscus can be vulnerable to small tears. These are often called degenerative tears. Unlike sports tears, degenerative tears can come from twisting while walking, getting up from a chair, squatting or kneeling, general wear and tear over time. They are particularly common for people over 50. People often describe the pain on the inside or the outside of the knee joint itself. There's swelling, there's difficulty bending and stretching the knee. Sometimes the knee may catch, lock or give way. This can happen when a small piece of the meniscus tears, breaks away and floats around the inside of the joint, causing the knee to be momentarily blocked. So it blocks the movement in the knee joint. Another sign can be not being able to fully extend the knee. When I was working as a professional dancer, I tore my meniscus and I thought this is the end of my dance career. I might need to have surgery. And at the time, it was during a rehearsal for a show over in Ljubljana in Slovenia, which is so far away from home. I was so scared. I just thought, this is the end of my career. If I keep moving on it, if I keep doing the show, my knee's gonna get worse. Maybe I'll never be able to dance again. I was just so very, very scared. So I came back to Australia. I saw so many different physios, sports physios, different people, and they gave me exercises to help strengthen my knee. I was starting to teach Pilates at the time, so I really focused in classes on that vastus medialis oblique because that was key to getting my knee strong again. And as I continued to exercise and to work, I felt like my knee was starting to get better and better. There was reduced pain. I regained confidence in myself again and my ability to move. And I'm so relieved I didn't go down the track of knee surgery, because later I discovered at a Pilates conference that I went to that quite often people who do have knee surgery end up with the exact same results as people who don't have knee surgery, except for one thing. People who have knee surgery end up having more and more knee surgery as they age. This experience is one of the reasons why I'm so passionate about Pilates. It really did help to heal my knee and it changed my life. The goal of rehabilitation is to restore range of movement in the joint, regain flexion and extension of the knee joint, strengthen the muscles that support the knee joint. These include the quadriceps, the hamstrings, the gluteal muscles and the calves, because that calf muscle also crosses over the back of the knee joint. Strong muscles help to stabilize the knee and allow the knee to move with better function. A study published in the British Journal of Sports Medicine found that exercise therapy can be just as effective as surgery for many degenerative menisci tears. So movement really matters. Always work with a comfortable range of movement and not into pain. Start with 10 repetitions of each exercise. Lie on your back with your legs long. We're going to have one foot on a slider. You're going to slide the heel towards you, keeping the pelvis steady, working through the core, lifting through pelvic floor. Take a breath, exhale and slide the leg out again. So breathe in, exhale as you slide in, inhale, exhale as you're sliding the leg away. Aiming for a very smooth and fluid movement. This exercise helps to restore knee flexion. It gently lubricates the joint. It helps the knee to maintain mobility. So the leg is long with a pillow resting under the knee. Gently press the back of the knee into the pillow and stretch the knee out, squeezing the thigh muscles. Pull the toes back. I like to turn the leg out slightly, so you're really working with that VMO, that vastus medialis oblique, working against the line of gravity. So you'll hold that leg long, isometrically, for a count of 5, 4, 3, 2, 1, and release, working up to a count of 10, 20, and 30. So this exercise helps to reactivate the quadriceps muscles. It helps to wake those muscles up, especially that vastus medialis oblique. The vastus medialis will wither if there's any kind of pain or injury in the knee joint, and then you can end up with a secondary knee injury, which is a tracking injury, where the knee doesn't track properly in that femoral groove. So we're going to have that same leg over the pillow with the leg nice and long. So you'll take a breath, exhale, stretch out the knee, float the leg up off the pillow, pulling those toes back. Energy right through the heel of the foot. Hold for a count of 5, 4, 3, 2, 1, and softly down. So you'll really focus on keeping those quads active as you're holding it in that isometric muscle phase, lowering slowly. This strengthens the quadriceps without placing excessive load on the knee joint. With feet hip distance apart, lift the pelvis up into a bridge position. Focus on activating the glutes, the hamstrings, and the core. Strong glutes are essential for reducing stress through the knees. And you also want to have the glutes working evenly on both sides, because if one of the glute medius muscles is withering, then the gait might change, putting more stress and load on one of the knee joints. So standing with your feet hip width apart, sit back as if you're sitting down into a chair. You can even start with a chair behind you, starting from sit to stand and then gradually hovering just off the chair. It's always nice to have a chair behind you if you're a bit nervous about falling over. So only squat as far as your knees feel comfortable. This exercise strengthens the glutes and the hamstrings. Functional strength like this is important for daily activities such as sitting and getting up off the toilet, getting out of bed. Hold on to a chair or a wall or a pole, something for balance. Lift your heels up and rise up onto your toes. You can hold for a count of 5, 4, 3, 2, 1, and slowly down. Strong calf muscles help support the knee and ankle alignment when walking. When recovering from a meniscus tear, focus on things such as maintaining your range of movement in the knee, restoring full knee flexion and full knee extension, strengthening the muscles around the knee that cross over the knee joint itself, the hamstrings, the quads. Movement should always be controlled and pain-free when moving. Meniscus tears are very common as we age, but the good news is that many people can recover from knee injury without needing surgery, and you can improve significantly through exercise-based rehabilitation. Pilates is particularly effective because it focuses on controlled movement, muscle balance, joint stability, and whole body strength. And as I experienced myself, the right exercises can help you avoid surgery altogether. If you'd like to learn more about teaching Pilates safely for aging bodies, take a look at my Pilates for Active Aging course, where we explore joint health, bone health, and intelligent exercise programming. Thanks for watching, and I'll see you in the next video.